Well, hello and welcome back to Med Monday. I hope you guys had a great week last week, and I hope this is going to be a fabulous week for you. So let's get started. Our medication this week is Lisinopril, and Lisinopril is an antihypertensive. It's also an ACE inhibitor. It can be given PO, and the mechanism of action is that it prevents angiotensin 1 from converting to angiotensin 2 by suppressing the renin-angiotensin aldosterone system, or the RAS. The indication, or why we give this medication, it is used in mild to moderate hypertension, heart failure, and for patients that have had an MI. Contraindications, or why we don't give this medication, include hypersensitivity. So again, that's an allergic reaction or any type of allergic reaction, hypotension, and angioedema. And I encourage you to look that word up. It's very important that you know what that is. Our side effects include fatigue and dizziness, and this would be predominantly to having a lowered blood pressure. So patients that have been walking around with high blood pressure and now all of a sudden we're treating it and we're giving them this medication, it lowers their blood pressure. And so while they're adjusting, they can have some fatigue and dizziness. They can also have headaches, a little bit of vertigo, and hypotension, and subsequently they would have tachycardia as a compensatory response to the hypotension. And for men, it's very common with any antihypertensive medication to experience impotence, and we do encourage our patients to discuss this with the physician. And they can also have hyperkalemia. And one of the most common side effects is a dry cough. Our adverse reactions, or things that could be potentially life-threatening, could be stroke, liver failure, pancreatitis, renal insufficiency, neutropenia or agranulocytosis, angioedema again, and anaphylaxis, and toxic epidermal necrolysis. So nursing considerations, things that we need to be thinking about while we're giving this medication. It is a black box warning for pregnancy and breastfeeding patients. So for our female patients that are within childbearing age, we want to make sure that they're aware of this and to report to the physician if they're pregnant or they're thinking about becoming pregnant. We also want to monitor our CBC, a chem panel, and our liver function. Chem panel also includes the creatinine, so we can monitor the renal function. We want to monitor our blood pressure, pulses, heart rate, and rhythm. And we want to make sure that our patients that have heart failure are weighing themselves daily. And we want to monitor for hydration status because it can tend to dehydrate patients if the dose is too high. So for patient teaching, we want to make sure, as always, to tell them to take medication as prescribed. We want to teach them signs and symptoms of angioedema. We want to also let them know that they should not stop taking this abruptly. That initially, when we're initiating the antihypertensive therapy, we want them to change positions slowly so that they can minimize orthostatic hypotension. We want our heart failure patients to monitor, well, actually all our patients to monitor blood pressure and weight, but especially our heart failure patients to monitor their weight and to report dry cough to the physicians because that is one of the most common side effects and it can be annoying. And we want them to avoid any additional potassium in their diet. So our challenge question this week, I want you to make sure that you do the challenge question and leave your answer in the comments because you will be entered to win a $25 Amazon gift card. Our challenge question is, your patient is being discharged and is prescribed Lisinopril 30 milligrams PO daily. The pharmacy only has 20 milligram tablets available. How many tablets will you instruct your patient to take? So go ahead and leave your answers in the comments, and be sure to subscribe to the Med Monday so that you can receive the medication fun sheets every week and any extra teaching that we'll be doing with that. You can go to NursingSchoolSimplified.com/Med Monday, and I'll make sure you get that every week. So thank you so much for being here today, and I hope you have a fabulous week. Make good choices, and we'll see you next time. Bye-bye.